I'm Professor Molly, and I'm going to go over some hemodynamics and some really important terms. So cardiac output, the formula here is heart rate times stroke volume, but it's important to understand what the functions of the heart are first, because your cardiac out is affected by three main things. So your heart rate, which is the rate and electrical impulses of the heart. So if there's a dysrhythmia or if there's a heart rate, if your heart rate's too fast or too slow, you're going to have a problem with your cardiac output. The next thing you're going to need is blood. You have to have blood, a decent amount of it, to pump and perfuse the body. So that's your stroke volume, your volume of blood pumping through the heart. So if it's too low or too high, it's going to affect your cardiac output. And the third thing is your contractility. And that's to strengthen the force of the muscle to squeeze. So if you've had a heart attack, or if you've had let's say, for example, you have heart failure, your heart does not want to squeeze, and that muscle is going to be damaged, and it's not going to squeeze that left ventricle to perfuse the rest of the body. One more thing is blood pressure. It's the pressure against the walls of the blood pressure. This can affect it too. But I'm going to mostly talk about these other three things because it affects cardiac output. Okay, I'm going to talk about the preload and the afterload right now. So when you talk about preload is the stretching of the muscles or the volume in your ventricles at the end of diastole. So when it's filled and about ready to squeeze out, that is the pressure there. And then I also want to talk about afterload. Afterload is really important because it's the amount of pressure your ventricle has to squeeze to overcome and generate the pressure to get the blood out. So that is trying to get into systole. Now, CVP is an important pressure to know when you're learning hemodynamics. It means central venous pressure. Another term is right atrium. So whatever the CVP pressure is, it is the pressure and the volume of your right atrium. That's what you're measuring. And typical is 2 to 8 millimeters of mercury. That is based on the resource book I was looking at, but your book or your facilities or policy may be different. So go off your providers or your facilities numbers when it comes to these hemodynamics. Afterload, again, afterload is the amount of pressure that your ventricle has to overcome. And I think about it, it's my SVR, my systemic vascular resistance. It can be, I think about it being the aorta, but it is the whole systemic system, which is arterial system throughout the body. And too much pressure or too little pressure, so dilation, too much pressure or volume, you're going to have a cardiac output issue. Normal is 800 to 1200. And if it's too low, then you are going to be dilated. If it's too high, it's going to be too constricted. And that left ventricle is going to have to overcome a greater amount of pressure to pump blood. So your cardiac output is really inversely related to your SVR. So your SVR, if it's too high, your cardiac output is going to be low. Now let's look at preload. If your preload is low, so some factors that affect preload being low is hypovolemia or vasodilation. And inversely, if it is too high, then you may have an increase of volume, which would be your CVP, or a vasoconstriction. Now, with your afterload, if you have an increase in afterload, this could be based on hypovolemia or vasoconstriction. If it is too low, so you have a decreased afterload, this is a vasodilation. So you're going to have to add a vasoconstrictor on to this patient. So we'll talk about drugs and what we use to treat these in the next section. Have a great day. Follow at Professor Molly for more nursing tips.